Alopecia areata, one of them. The prevalence in Saudi Arabia, according to a recent paper that was published 2 years ago, showed to be higher than the international numbers. It showed to be around 18% in male and 11% in female. And that is a great number and big number when you compare it to international numbers that are less than 5%. The story of alopecia areata is not the same. If you see 100 patients with alopecia areata, the presentation is different, the story is different, the prognosis, the progression of the disease, it varies tremendously between these patients. And so assessment is a fundamental and a must for our patients. As you can see, the presentation looks different in different people. And for assessment tools, there are variable ones. There is 5 of them that are more of a physician-oriented. There are 5 that are patient-oriented. Now it's Friday afternoon, so if I go over all these, I'm sure there'll be no one here except Dr. Fatani, because he enjoys assessment tools. So what I will be talking about today is a single one, and that is the SALT. Severity of Alopecia tool, updated in 2004. So this has been around 20 years that we know about it, yet I'm very certain that only a small number of our dermatologists do use this. Until recently, when we had the first Saudi FDA and FDA approved medication, where now it is mandatory that all of us, and it's required by both Ministry of Health and insurance companies to go with this SALT. So today, I'll just go step by step to make this more applicable, time efficient in our clinics. It's a simple tool where SALT 0 is no hair loss, so 0 hair loss. And SALT 100 is 100% hair loss. And you divide the scalp into 4 areas where you have the left side comprising 18%, the right side in a similar way, the back is 24%, and the top is 40%. And there are some, what I do actually, I do have this as a picture on my phone, so it will be easy to retrieve it because no one really will remember these numbers, but it will be easy. Or you can print it and have it as a copy in your clinic. Once you calculate the numbers, this will put you into mild, moderate, or severe, where the numbers for mild is less than 20. If it's 21 to 49, it's moderate. If it's more than 50, it's a severe alopecia areata. And this is the tool that's most commonly used in all papers. However, I want you to be aware of the absolute score, which I just explained, and the subscript score. The subscript score is presented as SALT with a subscript of a 50 or 100 or whatever number it goes there. And what it means is 50% improvement from baseline. SALT 100 is 100% improvement from baseline. So let's go over a case study. We'll take this step by step. And this is a case from the presented paper in 2004 of a gentleman who has a severe alopecia areata. So if we look into the left side, what would you estimate the percentage of hair loss? 90, 95%? 95%. So let's see that. So if you estimate it 95%, you multiply that by 18, which is the factor that compromises the effect of the left side. And then you get you divide that over 100 and you get a number of a 17.1. You apply that again on the right side. And we can see there is a little bit of hair over here. So what would you estimate the percentage of hair loss here? 90%. So you multiply that by 18. You divide it by 100, and you get a coefficient number of 16.2. If you apply that to the top of the scalp, what do you think is the estimated percentage of hair loss here? 95%, right on. So you multiply that by 40, you divide it by 100, you get a 38. And if you look at the back, would you say here it's 50, 55? Because you can see a little bit of more hair here. So this is estimated to be 55% of hair loss. So you multiply it by 24, which represents the back of the scalp, multiplied by 100 and give you a 13.2. then it's simple. You just add these numbers. Now, there is a website where you can just enter these numbers and it adds them for you and do the multiplication, so makes it even easier for your life. So the SALT assessment here is 84%. So this means 84% of his hair is lost. However, this, if you can notice, did not look into eyebrows or eyelashes, face hair, nail changes, which is all changes with alopecia areata. Progression of the disease, when was the onset, how active it is, how many weeks, months, did not even look into the quality and the impact, which just Dr. Abdullah told us how big is that impact on the patients. Someone might have a smaller area, but it's really of a great impact, and this should all be taken into consideration. So as a group, the alopecia areata group, the Saudi group, which did the guidelines, we took all these into considerations and we went back into the literature and looked for other scoring measures that can catch these changes. So the ClinRO measured the eyebrow hair loss. And it's a very simple tool that goes from 0, where there is a full coverage, so no hair loss again, to 3, where it is 100% of eyebrow lost. And you just give that a number. Again, would be great to have it on your phone or just print it in front of you in the clinic. Once more, for the eyelashes, the ClinRO goes with the same thing between 0, 1, 2, and 3. And in our treatment goals, we also included the DLQI, which we're all familiar with, just to catch up those patients who have maybe a smaller number of hair loss or a small area of hair affected, but more of a major impact on their quality. And this is the DLQI, just to remind you of it, which goes from 0 to a 30, and 30 is the maximum score. 10 questions can be really done within 5 minutes of the clinic. It has been translated to a lot of languages, including Arabic, and been verified as well. Another way is to keep it in your waiting area, have your patient fill it while they're waiting, so once they come in, you have that score already there. An international group, I'll just end up with this, they did modify the SALT and they looked into a different assessment tool just to catch all these changes. This was, I think, sponsored by Lilly as a group, and they came up with this, which was published in the JAD of 2022, but the Saudi group actually did take into account all these measures without coming up maybe with a tool, but we included it in our assessment and in our guideline. So to summarize, it's very important to use a validated measure to standardize the outcome data on therapeutic agents. This is now a requirement by both Ministry of Health and the insurance companies. The SALT, which is the tool that has been used in most clinical trials and the most commonly tool used, still have limitations, and these are where this hair loss is, what's the pattern of hair loss, the duration and burden of the disease. Adding the ClinRO and the DLQI will overcome these deficiencies. And with this, I conclude. Thank you very much.